We're going to talk about noses, all things noses.
We've got Dr. Mariam Sayedabadi.
Is there a prominent bump? Is the tip?
It's important to understand when we talk about swelling after a rhinoplasty,
To Amy Castano, one of the most successful beauty influencers.
You want it to look super seamless and natural.
Welcome to the first ever episode of the Doctor's Take on Aesthetics. My name is Dr. Josh Wall. I'm the medical director and co-founder of Contour Clinics. And next to me is the Tom to my Jerry, the Starsky to my Hutch, and the Jane to my Tarzan. Dr. Grant Ross, people.
Thank you very much for having me. Flattery will get you everywhere, Josh. It's a pleasure always to be here.
So look, each week we're going to discuss a non-surgical treatment, so whatever's trending at the moment. And we're really aiming at things to give you education on procedures. So things that you may be concept, problem aware, but maybe solution unaware.
You might have seen it, you might have had a friend, you're curious what's going on, what's this all about. So we're going to talk it through.
Absolutely. Now, the first episode today, we're going to talk about noses, all things noses. So our expertise as cosmetic physicians will be on the non-surgical nose reshaping. So Grant, do you want to tell me a little bit, what is non-surgical rhinoplasty?
Yeah, absolutely. So when we're looking at the nose, there's different parts. There's the top, there's the middle, there's the tip, and everybody is aware what is the shape. When people look at the nose from the side on, that's when these things start to stand out. And we're talking about a shape that presents itself from the side. Is there a prominent bump? Is the tip a little bit further back than it ought to be? What is the height of the nose? As cosmetic physicians, we're going to use filler. We're going to use products to inject into the nose in this line here to reshape it so that it looks as straight and nice as possible from the side.
Yeah, we use a thing called hyaluronic acid. So hyaluronic acid sounds like a kind of something you shouldn't be injecting into the skin.
Yeah, sounds weird, but it's just a collagen thing.
Yeah, look, it's quite interesting how it was the name actually comes about. So we actually find hyaluronic acid in a lot of tissues within the body. So if you're looking at nerve tissue, if you're looking at the fluid within the eye, if you're looking at the skin, or a few other different places in the body, and we've got about 15 grams in our body at all times, and we've got about 5 grams that gets recycled each day. So we have a whole range of processes and enzymes that are involved in making hyaluronic acid and also breaking down hyaluronic acid. So actually uronic acid is something we find in the eye.
Okay, so what does it do? Tell us what is the properties of it and what does it, how does it provide a bit of buoyancy in our faces?
Well, look, essentially what it's doing is we form it's actually not that complicated a process. I went to the labs in Geneva and seen how the kind of sausage was made, if you like.
Yep, and up there in the dark laboratories.
Exactly.
Yeah.
And there's really only 3 ingredients. So there's a buffer, there's the hyaluronic acid, and there is a lignocaine. So lignocaine is a numbing agent. So it's the same thing you get when you go to the dentist, that you're getting a tooth pulled. So those 3 things are within the filler itself. And essentially what the reason we put it in there is to add volume.
Yep.
So it's a gel-based substance that adds volume. Also will attract some water to the area. So there will be some moisture attraction. And in doing so, will increase the volume. So for the purposes of nose filler, we're going to look at increasing the height, the volume, the projection. And that kind of leads us on to our other stuff. What kind of things can we treat there?
I mean, that's a really good description. And what I like to tell people about filler is it's almost like collagen. We're adding volume and we're talking about shaping. We're putting needles into the right area so that we can create a shape that we're happy with. When it comes to noses, there's a few big categories that I think people come in concerned about and they're curious about. One of them is if they have a dip or a contour irregularity from the side profile. The classic one is the hump. Another classic one would be if the nose isn't tall enough, particularly, for example, in Asian patients, the height of the nose. And for some people, maybe a little bit of asymmetry, something's flowing one way or another way, aiming to add some volume in a minimal and controlled way to give it a really nice profile as best we can.
Absolutely, yeah. So you mentioned something really interesting there. It's like, this is mostly a side profile projection. So we have a lot of patients that will come in. So me personally, I do a lot of these nose fillers. And the usual concern is like this modern day and age of, Zoom meetings and social media and
selfie mania.
Selfie mania. People are getting tagged in photos and they're seeing themselves from the side.
Yeah.
And they're not really liking what they see. So maybe they've got a hump on their nose, or maybe their tip is not as projected as they like, or maybe their tip is slightly droopy.
Yeah, especially as you age, that's
absolutely, yeah. So part of the aging process will be to lose some bone in the mid-face, and also to have some overactivity of certain muscles involved in the face. So if that's in the chin, maybe the chin lifts up a little bit. That's why you see grandma has her chin that's kind of
grandma does, and grandma also has a droopy nose.
Exactly. So and there's a whole heap of different ways that we can very cleverly and non-invasively treat a lot of those. So why would you kind of say people would opt for nose filler over, say, a surgical rhinoplasty?
Yeah, huge number of reasons. I mean, one comment I get a lot from people who come in is they say, hey, I'm thinking about getting a nose job, but I don't want to go all the way. You've got these ideas of people walking out of hospital with big bandages across their face and they're down for 2 weeks and there's blood spilling out of their nostrils. And like, presumably you probably need to cut the nose open to do nose surgery. Filler's different. We're using a syringe. We're taking our hyaluronic acid, our collagen, our goo, and we're injecting it strategically, usually along the ridge of the nose, to bring it forward where it needs to go forward. So I've definitely experienced that one of the big reasons people come in is they're thinking about surgery. However, there's a whole retinue of people out there who are looking at it from a shape point of view, wanting something modest.
Absolutely, yeah. And you touched on an interesting point there, is that a lot of people are just wanting to test what a surgical rhinoplasty might look like. And sometimes that can be very reasonable. So sometimes it may be just a little bit of tip projection. So they're looking to have that. They don't really, maybe they're happy with their nose, but they just want it slightly better. So they want the tip to be slightly more elevated. And they're thinking, well, how might this look? How, you know, if I go and do this properly and have a surgical rhinoplasty, how might this look? And there are some people that are good candidates for that. So the one I just mentioned, a slightly droopy tip, they may be a good candidate.
So where do you inject for that? Take me through it. I mean, there's some muscles involved. There's just tissue volume involved. How do we go about sorting out a tip?
Well, look, what we typically do with a tip filler is address two different things. So one is to think, so before I'll explain kind of my thought process for this. So part of the reason you may have a droopy nasal tip is that you have a muscle that sits right around here. And for those that are listening at home, if you think about the meat between the two nostrils, that's called the columella. So the strut that goes between the two nostrils and that eventually joins into the septum is called the columella. And there's a muscle within that. And it's called the depressor septi nasi. It's Latin for depresses the septum of the nose, and that tends to depress the tip of the nose. And you'll see that sometimes when people smile, talk, laugh, their tip will actually droop down a little bit.
Maybe I can do it. Is that it? Is that it?
I mean, you've nailed it.
Oh, so good. But that's what we're talking about.
Exactly.
And if it was overactive, I'd be walking around like that.
Yeah, exactly. So,
and what would you do to fix me if I was walking around like that?
Well, I mean, I don't know. There's the
cosmetically speaking,
that would fix you. But
if I was normal, what would you do?
So what we do is we put an anti-wrinkle injection into it. So I can't mention the name of it due to TGA reasons. So we're prohibited from mentioning specific products.
We call it anti-wrinkle.
Anti-wrinkle muscle relaxant. And what we do is we relax that muscle. So by relaxing that muscle, we don't get as much downward movement of the tip when smiling, laughing, talking. And also that can just at rest slightly raise the tip. Now, when surgeons do a rhinoplasty, they actually cut this muscle.
Right, they get rid of it.
So they just, it is cosmetically and really functionally a relatively useless muscle.
Yep.
That we can do without, particularly aesthetically.
So cosmetically speaking, I've got someone coming in and I'm thinking, okay, the profile of the nose warrants bringing this tip forward, up, more projected. Anti-wrinkle injection is a part of that. How far does it take you wanting to bring that tip
It's
up?
subtle. It's a very subtle treatment. So it's really not going to do too much in terms of like a significant lift.
Yeah.
It's the cherry on top. It's the thing that some people, it is a necessity. For some people, it's just the,
we're here, we're doing this. So
what really does help is some dermal filler.
Yeah.
So the hyaluronic acid we spoke about before, a little bit in the tip of the nose itself.
Yep.
So on the top part of the nose, and then sometimes we even put some deep to that columella, to the strut between the two nostrils. We will go deep down there with a needle, after numbing cream's applied, of course, and go deep down to the bone there and raise the whole nose up.
So how deep are we talking? We're really talking at the base here.
At the absolute base. So it'll actually, not to try and scare people, but it may we go down onto the bone.
Yep.
And we actually provide some volume onto the bone, and then that lifts the entire structure of the lower part of the nose up.
Yep.
And that can be quite an effective treatment for some people. particularly those that this also helps as well with the actual columella itself. So some people, we also look from the side. So if you look from the side for me, for the people at home, I'm looking.
Here, we'll do an ABBA so we can see.
So you're looking at the side here, this columella. It's how far does that stick out? So how far does that bit of meat there between the two nostrils stick down? That's called columella show.
Yeah.
So we're...
Columella show, it's got a ring to it.
It does.
You've got a good columella show.
Thanks, mate. So we may want to put a little bit of... Depending on how some people have hardly any columella show at all.
Yeah.
And particularly those that have had a rhinoplasty that hasn't been as effective as they'd hoped.
Yeah, some tissue's destroyed. It's not projecting, it's not lifting.
Yeah, maybe there's been some contraction during the healing process that has forced the columella slightly more up into the nose. So those things are quite... putting filler there can be quite helpful for that as well. So there's multiple different considerations. So look in short, raising the tip of the nose, a little bit of filler in the top tip, a little bit of filler deep if required, based on how the columella looks, based on the angle as well between the columella and the actual top of the lip.
That's a really good point. I was about to ask you that, because looking from the side on and other people's noses and the anatomy textbooks, it's not just 90 degrees out we go.
No.
There's a subtle sort of line there. I can't tell you the degree, but it is more than just out. It does lift.
Absolutely, yeah. And we use a really cool technology here at Contour Clinics. It's called the Vectra. If you guys can even pop that up for us for the people that are watching on YouTube. So this Vectra camera here is really awesome. So here's a patient that we've done, and we've done a little before and after of what things look like. So if you can turn it to the side, guys. So what I'm showing here is a before and after of what we've done for the nose there. And with this software, we can actually go through, and the angles that Grant and I were talking about before, we can actually do those angles on everyone. And there are some norms that we will try to adhere to based on whether you're male or female or what look you're going for. That can help guide our injections. So we find this 3D software called the Vectra that's now performed at all of the Contour clinics.
We've covered off the base of the nose. We're talking about columella show, what's going on at the nostrils. Let's move up a bit. Let's talk about humps and bumps.
Perfect, yeah. So look, dorsal hump is something that's very common. So it's a hump in the nose here. So dorsum just means the kind of top side.
Yeah, the fin.
Exactly. The fin of the nose. And some people have a little hump there. And that's really, like, as a cosmetic physician, that's what I see the most in terms of nose filler.
No question. Yeah.
And for us, it's it all depends on how severe it is. But for those that are mild, moderate, it's quite easy to put a little bit of filler in there. So essentially what we try to do is we try to camouflage the bump. So we put a little bit at the top, a little bit just past the bump, and a little bit just to raise the tip. And we find that can make a really kind of beautiful straight line with a slightly raised tip. So a really nice aesthetic nose, but without the kind of downtime and expense and risk of a
I mean, realistically,
rhinoplasty.
law of averages, someone's come in, they've got a dorsal hump, it bothers them, and we're thinking, okay, we're going to do some injections above and below. How many injections, how long does it take? What's it like to go through this?
Yeah, it's funny you say that, because it made me think about there's a lot of marketing in cosmetic medicine. You'll hear all these kind of things.
We're on a cosmetic podcast.
there's a whole heap of things that
other people do it, not us.
We've never done it before.
No, never.
But there's a whole heap of things like the Tinkerbell lift. There's the 3-point lift. There's look, to be honest, it's all basically just marketing.
Yeah.
So the 3-point lift, if someone's trying to do 3 points in your nose filler, I can see how they could make a nice result. But if you come into me and how many injections are going to be, I don't know. It could be 3, it could be 10. It's a sculpting process.
Yeah.
So I'm going to do as minimal injections as I can to give you the result. But it's also a sculpting process, because the least amount of injections I can do, the lower the risk. So each time we pierce the skin, there's a risk of infection, there's a risk of bruising, there's a risk of injecting into a blood vessel, there's a risk of, some of the more serious side effects, which are very, very rare. But we try and minimize that where we can. But it's just an interesting point about this 3-point lift and versus Tinkerbell versus all
exactly.
those
It's misleading. It tells us this or that, and you make a a good use of the language sculpting, and I mean it implies that you do an injection and you have the ability to move around to the side and see the effect of that.
Yeah, it's one of my favourite treatments because the results are immediate. So,
yeah,
I mean, it's really one of the best parts of my job because someone can come in that can have a problem that's bothered them their whole life, and then within a minute I fixed it with a tiny little bit of dermal filler.
So, who's a good candidate for this? We're talking about dorsal humps and bumps and columnar show. Who is a good candidate for it, and when would you say, okay, maybe this is not going to be the best thing to do?
Look, I'd say the best candidates are for it. Someone who's generally fit and healthy.
Yeah.
All right, that's the first thing. Someone who has realistic expectations of the treatment.
Yeah.
They're the first two necessities when it comes to anything cosmetic medicine.
Anything.
The next people are those that, so really from a side profile.
Yeah.
So from the front, we can do very, very little.
Yeah.
Some very mild deviation we may be able to fix, but it's something that I would very much temper. Like I wouldn't want to oversell.
And why is that? Why can't we go looking to add some filler along here and here and here to bring this width to this width and so on? What's the catch?
Perfect question. I've actually, here's an anatomy slide I've prepared earlier. So for the people listening at home, basically there's a picture of nose anatomy. And essentially what it gives you an idea of is that most of the vessels come from the side. So there's really not much in a normal nose.
Yes.
There's not much in the way of blood vessels right in the midline. And if we're in the right plane, which we put our needle deep down to the bone, and in that plane there are no blood vessels.
Yeah.
So needle placed properly, delivered sensibly, there's really not much of a way we could put it into a blood vessel. Now, there are some definite caveats to that. So staying in the midline is very safe.
Yeah.
So we can't really inject on the side safely.
Yeah.
We can inject wherever we want, but just not safely.
Very good comment.
We try and make it. The thing is with all these treatments, this is a cosmetic treatment. This is not life-saving chemotherapy.
No.
And we always temper anything in medicine. Like when we went to medical school, first week medical school, they'd say, do no harm.
Yeah.
And this is especially true in cosmetic medicine because we are doing something that's purely aesthetic. So we like to keep things very safe, very considered, and, we don't like to run into any risks unnecessarily.
And that's a principle not just of cosmetics, but especially for filler. I mean, we probably could just spend a moment to go into the thing we think about the most as filler injectors, blood vessels. Why? Why are blood vessels such a thing for those of us putting needles in?
Yeah, look, they're very important because, and especially important in the nose. So speaking about them generally, there is a risk, and this is the risk that there's two risks that my patients will tell me about. They'll come in, they've read horror stories online, they've seen the 60-minute specials, they've seen the ultra rare complications that happen, probably will never happen, touch wood, in my lifetime, in my practice.
Yeah.
But they're very incredibly rare. So what's happening is that there's some filler going into a blood vessel, into an artery, and it's blocking the flow of blood to the skin.
Yeah.
So the skin's not getting oxygen and nutrients it needs. And if that persists untreated, that can lead to death of the skin, so necrosis of the skin. The beautiful thing about hyaluronic acid is that it can be reversed.
It can.
So if you were to be unlucky enough, if you won the unlucky lottery, if you hit that 1 in 40,000 complication for blocking a blood vessel, it can very easily be reversed. Now, injecting in other parts of the face, say if I inject in the cheek here and I block one of the blood vessels, I've got 5 other blood vessels supplying that cheek.
Yep, there's plenty going on.
Plenty going around, and whilst I still need to reverse the filler, it's not as big a complication.
Yeah, and they're bigger vessels, there's a lot of collateral going on.
Exactly. And when you say collateral, it's other blood vessels that will help to supply that skin.
Coming in and plugging in.
Plugging in. So there's lots of different plugging in going everywhere.
Yeah.
And with the nose though, if I block a little blood vessel on the nose, that's the only vessel. So there's not much in the way of collateral circulation. So that's why we worry a little bit more about the nose.
Yeah.
So we're very slow, we're very considered.
And there's a line of danger sort of running sort of just parallel in a way to this middle part of the face where a lot of those arteries turn up and travel.
Absolutely, yeah. So where the arteries really are, there's 3 main ones of note, and they all follow in the same. So if you go to the iris of your eye, if you go to the middle part of the colour bit, and you draw a line up, you've got the supraorbital, supratrochlear arteries. If you come slightly down to the cheek, you're going to have the infraorbital artery. And then in that exact same line, you're going to have the mental artery down just under the lip.
Yeah.
So we try and avoid those areas where possible. And these vessels from there are going to spread out, particularly around the nose, are going to spread out up into the nose. The other complication that patients will often come to be concerned about is an exceedingly rare complication that I think's happened once or twice in our country ever.
Yeah.
And that's blindness from filler.
So how does that happen? Like we've talked about blood vessels, blindness. What goes on, God forbid, if that happens?
Yeah, it's I would just want to reinforce how incredibly rare that is. Yeah. Essentially what happens, filler goes into a blood vessel, okay? Usually around the most common place that happens are in the nose, and in this place called the glabella, it's right between the eyes. It's where your monobrow should be.
Where my monobrow usually is.
Where it is.
Where it is.
So in there's a lot of blood vessels, and if you are unlucky enough to get into that blood vessel, and you put the filler in at a force that exceeds your blood pressure.
Yeah, so you override the pump, you're shoving it in.
You're essentially going against blood flow because it has to go against blood flow. So you're going to be unlucky enough to get into a vessel. You're going to put it in hard enough to go against blood flow. And then you can put enough in that it fills the whole volume of that blood vessel until it gets to the back of the eye.
So we're a Swiss cheese model here. We're talking about a lot of things that you have to...
We can line a few ducks up.
Line a few ducks up the bad way, and then bang, that can happen.
Absolutely. And there's been some very clever studies that have looked at the actual volume of blood vessels from the nose to the back of the eye.
Yeah.
And we know that, and there's a whole spectrum. So, if you're looking at someone like this 50 kilo female versus, Dwayne The Rock Johnson, their arteries are going to be different.
Yeah.
Right. So they're going to have different volumes. So what we do is we play to the smallest volume of artery.
Yeah.
So we know it's about 0.01 of a mil.
Yeah.
To get to the back of the eye. So we do a thing called decanting of the syringe. So we put it into a smaller needle. So then we can more easily or more accurately deliver filler. Yeah. So we never go above 0.01 of a mil when we inject. So theoretically, it's impossible for us to get to the back of the eye.
And this is about taking a cautious approach to doing
Absolutely
this.
Cautious approach. Like we said before, this is a cosmetic treatment. This is not a life-saving operation. It's something that's it's desired but not needed.
Yeah, and that's a fair comment.
We have to be very, very much...
So we're out there, we're going to be injecting, we're going to be sticking to the midline. We're aware that those blood vessels travel either side. And that brings us to, from the columella up to the top of the nose. Where should the top of the nose begin?
Good question, yeah. So ideally it would start at the lash line.
How's mine? Is it there?
Turn side. Oh, mate, it's textbook.
Textbook.
It couldn't get better. I mean, your jawline's a bit weak, but...
that's another podcast we're going to have to do. It's going to have to do. You're depressing your nasal septic muscle. Look at you. Completely unprepared.
See, mate, I'm on brand here.
Yeah.
Doing it for the people. I forgot your question.
Would. There are three big areas I think people come in and they're asking, hey, can you reshape this?
Yes.
And we think, yes, we can. One of them is the tip. What's going on here? It's
dorsum.
a bit flatter.
The tip, top of the nose.
The height of the nose. And what group of people seem to show up and say, hey, can I have a taller nose?
Yeah, I see where you're going with this.
Yeah.
So our... Asian patients typically don't have much of a bridge of a nose, if I'm going to generalize. And they will come in. So some of the things they'll come in and tell us about, they may say, I can't wear glasses. The glasses just slide off. I don't really have much of a nasal bridge to actually rest the glasses on. So we give them that nasal bridge, right? It's just by putting filler in there.
Yeah.
So they need a little bit more than our Caucasian patients usually. So patients that already have a bit of a nose, those that have hardly any nose, we may have to build it up over time.
Because what you're talking about is if we do start up the top, we're building that nose projection from that level. We have to carry on through.
Of course. And we also, it's a good question you asked about, where should the nose start? I mean, it should really be at the lash line if someone's looking in a neutral gaze.
Yep. Straight ahead.
So looking straight ahead in a neutral gaze, the nose should start there. And that's another question that I find common in clinical practice is people are concerned. They've seen the before and afters on Instagram, obviously not where we work, somewhere else, of noses that are starting on the forehead.
So they've just filled them up, gone hell for leather.
Gone for it, got after it.
Yeah.
now the nose is starting
reckless
up at
abandon.
the hairline.
Yeah, look a bit like from the Muppet Show.
Exactly. So this kind of leads us into like just having a sensible clinical eye.
Yeah.
Not going over the top. I mean, we really pride ourselves where we work here at Contour Clinics on just being very natural, very subtle, very understated, very much like aesthetic but not done. Noticed but not known.
The enemy of good is.
What is
God,
that?
you got to take your pills, mate.
Yeah, I know. I'm struggling.
The enemy of good is better.
That's true. Yes, I do say that.
You do say that. Grandpa's off the beat.
Yeah, I know. I'm off my dementia meds.
Well, I think that's a good overview. We've talked about the tip. We've talked about what's going on here. We've talked about the dorsal hump. We've made a few comments about safety. We've made a few comments about size.
Yeah.
People who are, I wouldn't say on the nose, but who's on the edge of being cautious about going and having nose filler? Who should be a little bit more careful about having it?
Yeah, look, I mean, I've just before we go on to that, I was kind of thinking about why I'm struggling to remember. I think it's because my back's sore because I'm carrying this podcast.
Oh, you're carrying this one. Oh, here we go. Sorry.
That's right.
Can we unplug his mic before he does any more damage to comedy in this world? Thank God you're a good injector. Just say, no amount of filler will lift that joke off the floor.
Anyway, so your question is that those that we should be cautious about in terms of doing cosmetic injectables or in the nose itself, those that have abnormal anatomy.
Yeah,
specifically
you're talking about the nose, not you and the way you look.
Yeah. No, of course. Yeah. So those that have undergone a previous surgical rhinoplasty.
Yeah.
So they're ones that whilst we still can do treatments, we're very cautious because the anatomy has now been distorted.
Yes.
So where we know the vessels to lie normally, they perhaps may not lie there.
Yeah.
Now, what will happen with a surgical rhinoplasty is that you will get scar tissue form. That is 100% of the time.
Yeah.
And as you're doing an injection, if you're injecting into scar tissue, filler will travel down the path of least resistance.
Yeah.
So sometimes that least resistance can be down a blood vessel.
Yeah.
So that's why we're slightly more cautious. We're already cautious. We're even more cautious in those that have undergone a surgical rhinoplasty. And often what will happen in, say, in a place like Contour Clinics is that we'll only our most senior doctors will treat those patients.
Yeah. So there's a comment about experience, and of course we would be experienced also in being able to quickly reverse filler, keeping an eye on what's going on, how's that blood supply.
Of course, yeah. So
how about fractures? People go and play sport. We know about the rugby nose bang. They've done a Stephen Fry. We know that asymmetry is tricky to treat. We don't want to be traveling down here. What's the safety like for someone who's had a broken nose?
Look, it would be. I would argue it's probably not as dangerous as someone who's had a full-on surgical rhinoplasty, but it's just someone also we need to be cautious of, and also cautious anatomically, cautious with our injection technique, but also cautious as to, can we fix this problem? Are we managing this expectation well?
Yeah, or are we just tinkering and
absolutely. Do you think patients, tell me about the satisfaction of nose filler. What do you
Frankly,
say?
very high. And not just because it's a substitute for going and getting a nose job. I mean, granted, that's a really good reason that actually it's a very good thing that we have nose filler because of the drastic difference in the downtime. As you say, when somebody comes in and they notice from the side profile there's a difference in their contour, and with such a little amount of filler strategically placed in the midline in real time, you can see that even out and come good. It's a nice thing to be able to do. I agree. It's very satisfying. You line up, you do the targeted injections. I keep going around to the left and the right, and I double check and I squint and I move their angle just to.
Yeah, it's very much a sculpting process, isn't it?
Yeah, like clay, the artistry of the nose.
Like you like the Patrick Swayze of noses.
The Patrick Swayze of noses in every respect. Yeah, in every respect. Yeah.
Thinking about nose filler. So, are there any other options that we do?
So, really want to flesh this out just a bit. I've had a few patients in my old position in Hong Kong, a lot more Asian noses, and people there often ended up having nose threads. I think the attempt was to increase the sharpness of the appearance of the nose running from top to bottom by putting in a thread. And what a thread is that it's tunneled from here up to here, just underneath the skin. And a thread is, just as it says, it's like a suture, and it sits there. And I think the attempt was...
What's a suture?
A suture, like if you're stitching somebody up, with a string or something like that. Commonly we use them. There's a few reasons threads are used in cosmetics. They're there generally to hitch or tighten an angle in the body. They're burrowed underneath into the fat layer, and then they're pulled up a little bit along one vector. I feel that what was going on in a lot of these patients is that the attempt was not just to straighten, but really sharply define, and the suture would sit under the skin and divide the light. What's your experience been here in Australia? What's the deal with nose threads?
I would agree that nose threads are probably the most popular in our Asian population, and like you very rightly said, is to build a nasal bridge, and also to make a nasal bridge less blunt, so to sharpen a nasal bridge, to make it more narrow. And you need quite a few threads, and it's my experience you need a few sessions over time, and it's also my experience that it's very, the three most dangerous words in medicine in my experience. But just to give the listeners a bit of a feel for what we see here is it takes a few sessions, so it's a very subtle treatment. There is another way to make the nose appear more thin, and it's with filler, and it's using a cannula. So a cannula is a blunt needle, and essentially what we do is feed it up the bridge of the nose here, and we try and make it more straight. We can do that, and I've seen it done successfully. I've also seen it look amazing on the day, and then a few days later it's kind of everything's settled in and it's really no.
Because filler and threads and all these things, we deposit them there to raise the tissue and create a shape, but they don't just stay there. What happens to a filler once we inject it?
It integrates. It integrates into the tissue, and your body's natural tendency is to revert back to how it was. So the body, into every process in the body, whether it be how things look, how things function, there's a thing called homeostasis. It's this natural state of being, and your body wants to be in a certain state of homeostasis. And putting things into areas, your body will want to just generally revert to how it was, and everything will want to just settle back into place. So with filler, we do find that whilst it can look slightly more narrow, it doesn't tend to stay that well. Same with nose threads. The threads dissolve over anywhere from 6 to 18 months. And to go into threads a little bit more, people might not know exactly what threads are. Think of threads like Grant very rightly pointed out, a stitch. So a stitch is something we use in an operation. So
bit of string, a rope, needle on the end. Bit of string.
Let's sew up your appendix. You need a new heart vessel. Let's sew that together. It's essentially a fancy surgical form of sewing. And it can be made of a variety of different materials. The one we commonly use is PDO, which is polydioxyinone.
Glad you know it.
Yeah, I probably didn't say that correctly either. I always get that wrong. But, and essentially what it is that stitch, but in cosmetic medicine, often those stitches will have little barbs on them.
Yeah.
And the barbs are very, very small. So the barbs hold everything in place. So if it's hitching up the face, we're using the barbs to hold everything in place. In the nose, it's to make sure everything kind of stays where it is, and also to kind of raise the tip slightly as well.
Yeah.
Problem is with the threads, though, they don't often last very long.
Yeah, so the body goes in, it's going to eat it up, it's going to metabolize it, and then you're kind of back to square one. So in a way, if I'm coming in and I'm saying I've got a bump, or I want to sort of straighten this, and I'm thinking, okay, I can go down the pathway of having a cannula and threads, and it's going to be bone sharp and razor thin, versus sort of I'm looking from the side profile, I've got a bump here and a bump there. In the long run, which one seems to be the one that produces the results that people go, oh yeah, that did the job?
Yeah, so it's definitely from the side profile perspective.
Yeah.
So that produces, for starters, very safe, very predictable, very efficacious results, and a very high satisfaction rate. Those that are coming to fix an asymmetry from the front or make the nose appear, more narrow, whilst there are ways of doing this that can be effective, I find them less predictable.
Yeah, we're able to sculpt, but not to that nth degree.
There are always limits, and that leads me on to another important point about there are limitations. Yeah, the limitations in nose filler are this is a very kind of confined space.
Yes,
and there is only so much space. So, for instance, in the tip of the nose, there's a tiny bit of space in there. We can put some filler. We can raise the tip. if we overfill that space, think of it like a closed box. The more I put in there, if I've got a blood vessel traveling through the middle of it, I'm going to eventually close that blood vessel off. So there's a fine line between giving you the result and also making it safe. So we don't want to overfill that area. And as experienced cosmetic physicians that have been doing nose filler for many years, you get a feel for how much that tip will take, and we stop well before that line.
Yeah, we're talking sort of this persistent redness, a pain, a hardness. Something's not quite right. We don't want to get to that zone.
Yeah, so we're very much...
and you get that in the chin as well.
Absolutely, yeah. So any part of the face, really, if you overfill it, you run the risk of blocking a blood vessel or causing a complication. So we don't like to push the envelope when it comes to that, because it is, like I said, a cosmetic procedure, and it's really not worth it. Now we've got some
friends,
some patient questions here.
Yeah.
I'm gonna
read them
one
off
for me. So look, high contour. This is Kathy.
Yep.
High contour. I have asymmetry in my nose. Can nose filler fix this?
If it's a small bit of asymmetry, there's just a little bit of a difference from left to right, potentially, yes. But on the whole, if there's gross asymmetry, probably not. I don't think that's the best way to treat that.
Yeah, I'd agree with that. I would say asymmetry from the front perspective is probably rhinoplasty would be your option, a surgical rhinoplasty.
Alrighty, well, Josh, the next question comes from Lucy. She asks, I have a droopy nasal tip. What can you do?
So this all depends. Hi, Lucy. Thanks for the question. This all depends on how droopy your nasal tip is. So like we've been speaking throughout the whole episode, there is a limitation to how much we can do. So if you've got a mild to moderate droopy tip, we can put some filler in the tip of the nose itself. Often you may need to put a little bit of filler at the top of the nose as well.
Even things up.
And give you a nice straight run into that tip.
Yeah.
And then also you can also put a little bit of anti-wrinkle into the actual depressor septinasia itself, the muscle that's involved in pulling down the tip of the nose, and that can be quite effective. If it is a severe drooping nasal tip, then the only option to completely fix it may be a surgical rhinoplasty. But it brings me to an important point, actually. There are some people who are not the best candidates for nose filler.
Yeah.
But for whatever reason, they do not want to go ahead with a rhinoplasty surgery. And they're happy, they come in and they see me and they say, and I manage their expectations, say, look, I'm not going to be able to fix this. They say, that's cool, just do what you can.
Yeah, it's not cheap to go and have nose surgery.
Of
It's
course.
several weeks off. It's a bit of a big deal. And look, there might be for other reasons that you can't have an anaesthetic. The list goes on. So there's just a big differential between a needle, a few spots
Of course.
over your lunch break versus a week in a hospital or whatever it is.
That's right. And look, for surgical rhinoplasty is a great procedure. And it actually reminds me, there's a really, really good website that people might not be aware of. It's called realself.com.au. Yeah, RealSelf. It's an American website. Excuse me. RealSelf. And anytime that someone's going to, or if any of our listeners out there are looking to undergo a cosmetic procedure, I would suggest you look at this website, because it has stories from, we're looking at rhinoplasty here, and there's it's almost 50,000 before and afters. There's 41,000 questions that have been asked, and you'll have cosmetic doctors like myself, like yourself, like our plastic surgeon colleagues will get on there and answer these questions.
Yeah.
And there's a really cool thing there. It's in the fast facts section about how many people think it's worth it.
Yeah.
And based on almost 22,000 reviews, you got about 91% saying that have had it, saying it was worth.
That's a pretty good tick in the box.
Pretty good tick in the box. Versus if we have a look at non-surgical, what's that? Yeah, cool. So
Yeah.
we've got 96% of
Okay.
people saying it was worth it.
Yeah.
So really both very, very highly rated procedures.
Yeah.
And look, like we were saying, we may not completely be able to fix it, but
Well, that's a good phrase that you often bring up. You say, look, I might not be able to do absolutely everything you conceptualize, but we can get an improvement. And in light of the vast difference in the risk and the downtime and the cost and all of these things, that's often where people start, and you say, hey, you know what, if you really like the look and you're sick of coming back to see me every year or second year, you might head off to the nose surgeons and have a chat.
definitely. So I've got Mary here that's asked a question. Hi team, I wear glasses. Can I proceed with this treatment? What?
Absolutely. And in fact, you said before something that I think is sort of we don't hear it all that often, but people say, actually, I can't wear glasses. They're sliding down my nose. They're falling off. So we hear about that a lot more because people come to see us. They want to build up that bridge area so that they can more comfortably wear glasses. The answer is outright yes, but we do recommend that for the first 24 hours or so, wear contact lenses just to keep pressure off the area.
Absolutely, yeah. And then we've got what's our last question here?
So our final question is from David, and he asks, "Hi, Dr. Josh, can you reduce the width of my nose base?"
The short answer is no, not non-surgically.
Yeah.
So non-surgically, I can't. I saw a video on Instagram. I can't remember who it was or what I said, but they were doing something with nose threads where they actually placed the thread under the nose here and they pulled it and made the nose shorter. But
part cosmetics, part piercing.
it looks a bit wild to me. So, and that's the thing in our industry. It's relatively unregulated, and you really need to do your research on who you go and see. Because things like that scare me.
Nose is not something you want to be doing in a dark alleyway.
Of course.
No.
And so look, you will. So the reason I bring that up is that I've seen it done before, so I'm sure people are advertising it. It's not something I would recommend. I don't think it'll work in the long run. I'd imagine that whilst it might give you the result for your before and after on Instagram, I would imagine within a few hours to days that result is gone.
Yeah.
So reducing the width of the nose base itself, rhinoplasty, surgical rhinoplasty is really where you want to go there. So, and it leads me on to another important point is that if you're thinking, so you're not sure whether you're going to do rhinoplasty, you're not sure whether you're going to go for a non-surgical rhinoplasty, you're thinking about both, go and have 2 consults.
Yeah.
Go and have 3 consults, 4
Good
consults. So if you're going to go and spend, anywhere from, I've seen them as cheap as 10. I would never recommend doing cheap when it comes to surgery.
It's your nose. Yeah.
And I've seen them very expensive, $30,000 for a just stock standard rhinoplasty. But what I would do is that I'd go and see, I'd see at least 2 plastic surgeons if I was going to undergo a rhinoplasty, maybe 3.
Weigh it up.
Get comfortable with them. And make an informed decision.
Yeah, know the full range of options. Know how long it takes, what the recovery is.
Read their reviews.
Read the reviews.
Yeah, absolutely. See their before and afters. Make a very informed decision. And look, speaking of rhinoplasty, I think it's probably a good time to. We have one of our surgeons here. Very, very special guest here. We've got Dr. Mariam Sayedabadi, female plastic surgeon based in Sydney. One of the very few dually qualified specialist plastic surgeons in the country, really. Completed both medical and dental degrees. Also has a PhD, is a sucker for punishment.
Yes.
Wow. We are very, very lucky to have her here. Welcome.
Thank you. Thank you very much.
So you're a specialist plastic surgeon. Tell us a little bit about what you do.
As you said, I am a specialist plastic surgeon and I do plastic surgery operations head to toe in a variety of procedures, going from facial aesthetics to body contouring and gender reaffirmation surgery.
Cool.
So a good variety of procedures, head to toe really.
Yeah, wow. And you do all the reconstructive stuff as well. So
Correct. So I do a lot of skin cancer and reconstructive as well as trauma reconstruction, both in the public and private sector.
Crazy. We're all talking about noses today. So we've essentially, Grant and I, we're both cosmetic physicians. We talked about nose filler. Amy Castano, and she's quite a well-known makeup artist, talking about how to contour your nose. Now we're talking about, the real business end of,
Getting in there
and, getting this done properly. Tell us, what is a rhinoplasty?
Yeah, it's a good question, actually. Rhinoplasty is essentially a term that describes an operation that's performed on the nose to change both structurally from a cosmetic point as well as functional aspects of the nose.
Yeah, nice. And I've seen a lot of different things. I have a very cursory knowledge of what it is, but I see an open versus a closed rhinoplasty. Can you kind of explain that for our lay kind of audience that doesn't know surgery at all? Yeah,
so as the name suggests, open rhinoplasty is when there is a scar. The differentiating factor is when there's a scar at the base of the nose, and therefore with that scar, we're able to actually open the nose up completely
Yeah.
and directly visualize all the components of the nose that are then changed in the rhinoplasty.
Yeah.
A closed rhinoplasty still has scars,
Yeah.
but it only has the internal parts of the scars that we give for the nose, which is inside the
So
nostril.
you're cutting up inside the nostril there,
Yeah.
so where it's imperceptible to anyone else.
Correct. So the open rhinoplasty also has those scars, but it also
Yes.
has a small scar at the base of the nose.
And is that something where you kind of peel the nose back so you can see all the cartilage and everything inside?
Exactly. So with an open rhinoplasty, you can directly see all the structures. And open rhinoplasty, I guess, is more suitable in situations where you are completely, I guess, taking everything apart and putting everything back together again, and particularly doing fine works to change the way that the tip of the nose looks.
Right.
Whereas a closed rhinoplasty is more suitable when there's just small imperfections, particularly bony bumps that can just be shaved off and doesn't need any other, I guess, fine work on cartilage and the tip.
So if you don't want to raise the tip at all, if you just want to shave that bone, then you don't need to.
Correct. If it's just a small amount of shave.
And when you do the cut there and you peel everything back, what structures are you interested in seeing? What are you looking for?
Yeah, so what you're going to see in that approach, going from front to back, is the cartilage, which is the fibrous structure or the firm structure that holds and defines the tip of the nose.
Okay.
And then going from further back, it also gives you more of the cartilage support that hangs onto the bony part of the nose.
Yes.
And in the middle, of course, you get access to the septum, which is the structure that divides your nose into two.
Right.
And so because you've got direct access, it's a nice way to be able to pull everything apart and pull everything back together in the way that you are designing it.
Yeah.
Mariam, speaking about that designing, if you reflect back on the patients who've come to see you over the years, what kinds of concerns do they have? What kinds of things are they trying to achieve?
Yeah, that's a good question, because the important thing about rhinoplasty is that everyone is different, and that's how, and everyone should be treatment planned differently, because a nose that suits one person, that suits you, may not suit you and would not suit me. So it's important to be able to systematically look at the patient and their nose and their concerns, like you said. So people often don't like the bump on their nose, or they may not like the way that their tip either droops down or is pointing too much, pointing up, or called a piggy nose. So everyone has different concerns, and it's important to have the discussion with the patient about what they think is a concern and what is a realistic outcome and what's really actually going to suit their face, because it's important for people to understand that, you know, you may like one thing or other thing, but it's also got to suit the rest of your face. And that's, I guess, our job. And it's a joint discussion between, you know, the patient and the clinician.
So we can't always walk in with a photo of a celebrity and say, hey, this is what we're for.
You can, and a lot of people do.
Book me in.
But the problem with that is that your face may not look like Kim Kardashian with a Kim Kardashian
Well,
nose.
that is the look.
Can I book in for a Kim Kardashian face as well? Do you have time?
So that's where the problem lies. So, I mean, people do come with photos and they say that they like particular points of certain, you know, different people. And it's okay to have that to some extent. But, you know, what our job is to, I guess, get you to understand that everyone is unique, and therefore different features and different points suit different parts, and it's got to come all together to make a harmonious and aesthetically looking face.
It's a very good point.
With when you do like one of these, say we do an open rhinoplasty, how can you actually tell you've got it to the point you want? What's your kind of process to?
So it's very much a systematic approach.
Yes.
So you start. The first step is to get good access.
Yes.
The second step is to pull everything apart so that you've got every component on its own.
Okay.
And then you start from the top and work your way down. So you work at the bony points, and at all times you're redraping the skin back over and having a look.
So just
to
pulling the
see
nose
how
back
things
down,
look.
seeing how it looks from the side. Yeah,
Exactly.
cool.
And you think, it
cool.
needs to do
Yeah, that's
more.
cool.
So then you pull it back and you do more. And it literally is like that. So I guess you have to have that eye to say what, where your end point is.
Yeah. I've had a look at some of the common questions people ask online. And one of them was like, do you have to have your nose broken? So they talk about like you guys making I don't know what they call them, osteotomies or something. Is that necessary for everybody or?
Not everybody, no.
when would you
Majority
do
of
that?
the cases, the majority of the times you do it because if you're taking the hump
Yes.
off, if the hump is significant enough, then what you end up with is literally an open roof.
Yes.
So you need to bring the bones in. You need to break them to bring the bones in so that the roof is closed. So sometimes you're not making the break in the bone to make the nose narrower, but you're slanting it down so that the nose can function as a nose and for you to be able to breathe into the nose because you've taken that hump off.
Because so if you left it like open but the skin's still over, what consequences does that have for the patient?
Difficulty breathing.
Okay. Is it also like a structural integrity as well, or not necessarily?
It's more the functionality of the nose. So you can't, if there's only skin supporting the top of the nose, then, the skin collapses in every time you take a breath in.
Yeah.
So if you think about, high pressure going in, airflow goes in,
Suck the
the
skin
roof
down.
sinks in. If you think about a tent,
Yeah.
if the tent doesn't have the pole in the middle,
Yes.
then it sort of just collapses down every time people move out of it.
Oh, interesting. And is there a time where you ever put like an implant in?
There are times where you put an implant in, and the implants that you put in is to build the top of the nose. So, and that's something that I guess more comes into account when you're talking about Asian rhinoplasty. There are certain, when you're trying to build the nose up,
Yes.
you've got to use an implant or rib, and that rib can be either from yourself or it can be from a donor rib that you can get off the shelf, which is now available, which is great.
Who supplies
Buy a
that?
rib off the shelf.
Get a rib.
That's crazy.
It's someone that's kindly donated their rib.
Yeah.
They're all treated, and they've been around for about 10 years now. So often people don't like to have.
Do you reject them at all, or is it's not like having a transplant from something else?
It's commercially available, so it's not like we take donors. It's a commercially available cadaveric
they've treated
rib.
it as
It's
some
been
way,
treated,
so
so
there's
it's
no
very safe.
immunological.
Yeah, correct. It's
Interesting.
very safe, and it's very commonly used both in
Interesting.
cosmetic and reconstruction side.
Yeah.
And it essentially works to build the top of the nose, as opposed to if you've got a hump and you're taking the hump down.
So say I come in for a rhinoplasty and you've got to, for whatever reason, need to do a graft. Why would you choose a cadaver over my rib?
The reason is it's just personal preference, to be honest.
So I can say I just prefer.
Yeah, you may not want to have the scar. Taking the rib does give a scar.
Yeah.
It's also painful,
quite painful,
afterwards,
isn't it? Yeah,
and you may
yeah.
need a night in hospital. Whereas if you get it off the shelf, you go home the next day. On the same day.
That does sound good.
A ready-made rib. I'll go for that.
Yeah.
Marion, we talked about the top of the nose, the bridge. Moving to the base of the nose, people who've got a wider or fatter nose, what can be done there and how do you go about that?
Yeah, so you can definitely narrow it down at the base, and that's done by bringing the alar, which are the nostrils. You can bring the nostrils in and reduce it, and that can be. You notice that on your assessment. So some people have flaring nostrils and some people just have widely set nostrils. So depending on what that is, you can address it, in a slightly different surgical procedure, but essentially it just means that you have a scar just around the base of the nose, which actually is not a bad scar because it hides in the crease.
Yeah, okay.
That's very true. And talking about all of this, one of the questions that many people are bound to ask, how long is the surgery and what's it like afterwards? What's the recovery looking like?
Yeah, that's a really important question. The procedure itself can be anywhere between 2 to 4 hours, and it's a day-only procedure where you get to go home at the end with appropriate pain relief. What the expectations should be in the following days after the surgery is bruising around the eye, swelling around the eye, so you do look like you've been in battle. And then over the next week or so, the swelling settles down, the pain settles down. When you go home, you have splints on the inside of the nose and you have splint on the outside of the nose. The ones on the inside come out at 1 week after the operation, and the one on top comes off on 2 weeks after the operation. And then depending on what your skin type is, there's the swelling side. Now, it's important to understand when we talk about swelling after a rhinoplasty, it's not the big puffy swollen face that we talk about, because most of that subsides at the 6-week mark. But it's the more finer, intricate swelling, which depends on your skin type, and that can sometimes take up to 12 months to settle down. So it's important, we always counsel everyone to tell them that really it's hard to know the exact outcome and result of your rhinoplasty until about 12 months down the track. Of course, there's always exceptions to that rule, and some people's results settle down really quickly, and others can take a little bit longer, but that's about the average.
Mary, you mentioned that there's going to be these splints and I imagine bandaging and all the things that anybody would have after surgery. Somebody has rhinoplasty and they go home and they recover. How long are they at home for? When can they go back to work? What's the typical picture like?
Yeah, so the first 24 hours, people are generally needing regular pain relief. It's not very comfortable. There's bruising around the eye. But really, after that, everyone's different. So you're able to get on with your daily activities the day after. You can't drive for 24 hours after the operation. But other than that, depending on the type of work you do, you could go back to work. You look bruised and battered for a week or two. But in terms of exercise and doing anything, contact sports are out for 6 weeks.
Yep,
and
enough.
Most exercise is going to be out for 2 weeks.
Yep.
So any sort of heavy lifting or anything like that is out.
More than just sort of walking and gentle.
But yeah, just doing your everyday things is generally just depends on, how you feel the day, the coming days after.
But even like for somebody, 24 or 48 hours later, they can hit the keyboard, start doing some emails.
Absolutely.
Tidy the house up. Whatever.
Yeah, well, maybe not tidy the house.
I'll drag that one out.
but you can do other things. You can definitely,
yeah.
you can go and have a coffee. You can, do your daily stuff. And if you're in office work, you can do your, you can still continue your office work. Yeah.
Pretty good.
Speaking of kind of results, you mentioned results of rhinoplasty. I've heard there's a little bit of a revision rate for rhinoplasty. What would that kind of roughly run at, do you think? Like the need to do a second surgery, and what cases would you typically see those in?
Yeah, look, the revision rhinoplasty rates is really difficult, and it can range anywhere between 2% to 20%.
Yeah.
And that has to do a lot with the, satisfaction rate and depending on the type of rhinoplasty that you've had, there's always going to be, well, I clarify that, not always, but there can be often lumps and bumps, particularly if you've had break in the nose. And sometimes then they're usually not visible, but they can be palpable in that you can feel them but not see them.
Right.
And if that's annoying, so they can be minor adjustments where there's revisions. The major revisions for things like the nose not being straight enough, and that sort of, they're the major revisions that we talk about, and those rates are generally low. So they're probably, in the 5% range. But like any surgery, I guess we always talk about revision. But rhinoplasty is one of those procedures where the revision rate is variable. It's very much dependent on the clientele.
Yes.
So I think the best way to mitigate and lower the revision rate is having a clear understanding of outcomes.
Just managing expectations.
And the person that's coming to have a rhinoplasty really getting a good feel and understanding of what to expect, what is a reasonable outcome, what is a reasonable expectation. Because I think, knowledge is power and knowledge is success. So if you've got all of that down packed and you've had appropriate communication, really the revision rates are minor.
It's not too bad. Yeah, cool. And sometimes we will see, you mentioned that sometimes there's very, very slight abnormalities post or little contour defects. We very occasionally put some filler in. Is that something that plastic surgeons do? A little bit of filler here and there to help?
Yeah, you definitely can. I mean, we're always obviously cautious after a rhinoplasty because the blood supply to the skin has now been changed, and especially early after a rhinoplasty where the blood supply is just starting to re-establish, you've got to be really cautious and careful with that. But there is definitely some indications where, an option, instead of going back to theatre, is to have some filler. And sometimes that's a really good way of also assessing if it's worth going through surgery again. So if you get a good effect with the filler and you say, yep, that's good, but I don't want to come back to get fillers, then I'm happy to go in and get that area adjusted.
And what are your rules for fillers afterwards? You mentioned you don't want to do it too early. When would you suggest?
Look, I think you've got to wait. I prefer to wait at least 6 months.
At least 6 months, yeah. Look, we where possible prefer not to do them, and we always suggest going back to see your original plastic surgeon because they are the ones that started the thing in the first place. So
they know what's happened and what's
someone
different.
else's work. Interesting thing. So we've had a surgeon previously that he works in Sydney and suggests you have to reverse all filler before they do a consult. Is that something that you would typically do? Have someone revert if they've got filler in already before you see them? Is it that you want it completely reversed? Or
look, it's nice to be able to do that. It particularly after the rhinoplasty because like we talked about initially in the open rhinoplasty, you're lifting the skin and then you're making your changes and then you want the skin to re-drape. Just like when you're making the bed in the morning, you lift the sheets up and then you throw them over. And if you do have fillers in, then it doesn't re-drape as well. So it's nice to be able to
fresh canvas.
Kind of have that even surface so that you know that it's your work that's being re-draped and you don't get the lumpiness that you could potentially get. Having said that, sometimes it's just not possible to completely reverse everything, particularly if it's been long-standing. And so, when you are doing the open rhinoplasty, if you see them, you can remove them to some extent.
And I know in like other parts of the face you might do like a fat transfer or use something other than fillers. Is that something that ever's entertained in the nose or not necessarily?
Look, you can have dermal grafts and we talked about cartilage grafts
What's
before.
a dermal graft?
So dermal graft is essentially using a part of the deep surface of the skin to help with the contouring. It's not done often and there's not often an indication for it.
Interesting.
But you certainly can read about it and it's in the literature. It's not something that's routinely done.
And what would you kind of roll it up or something and stick it in there?
Well, you just essentially, it's just like a sheet that you can lay over. And, there are also things that you can, if you have crushed cartilage, that you can wrap the crushed cartilage in and to put on there. Again, if you're trying to smooth the top of the nose. So there are things, again, usually they're not used in a primary rhinoplasty. So someone that's having a rhinoplasty for the first time, it's often not necessary to use those. They're kind of when you're getting into the complex
like
revision
kind of sixth
type.
time.
And that's probably not a place you want to be.
No.
No. I mean, we've all seen it on that show, Botched.
Exactly.
I think I've seen them do all fancy things with cartilage.
When you're getting fancy,
they're renovating.
There's multiple.
There's multiple renovations.
And there's multiple structural problems, so you don't want to get there.
Exactly.
You don't want that nose.
One other thing. So our main concern with doing filler now, it's a very, very rare side effect, but it is the blindness from filler, getting into the ophthalmic circulation behind the eye. I was just thinking, is that ever a thing with surgery? Like, can you get a clot form because of the surgery itself, or is that something you've heard of, or is that not really spoken about? Or
look, I think in a rhinoplasty, blindness is probably not one that we talk about. There are other risks, and the more serious risk that we talk about in rhinoplasty is you can have pretty serious bleeding.
Okay.
And it's not common, but that can happen. The other risks of rhinoplasty is probably more so in people that have had previous sinus surgery.
Oh, yeah.
And that is really more about communicating to your surgeon any previous surgery you've had, particularly when we are doing the breaking of the bones. It's important to tell the surgeon if you've had previous operations, because we want to know that if the integrity behind the nose, that the structures are there and they're intact. But in terms of serious complications of blindness is not really one
something
that is in a
guys
rhinoplasty.
think about too much. Yeah, okay. Well, look, I mean, I guess that's probably all the questions we have for you. In terms of going to see a plastic surgeon for a rhinoplasty, do you have any kind of tips, tricks, for our listeners out there? Or?
Yeah, I think, do your research and have in your mind what it is that really bothers you about your nose and what it is that you want to come out with. And the really good thing that I think really helps people is when you're going to see your surgeon, have a list, like a shopping list of questions, and then you can go through them. And if you have someone with you that can come and absorb the information, even better. Because often in a consultation, as you know, you can have tangents and you sort of forget the questions that you want to ask, and you always walk out and you're like, completely forgot to ask the most important question that I had.
Of course.
So it's good to write things down, and that way you can address all your questions and you can always come back for a second consult.
Perfect. Beautiful advice. Well, Dr. Mariam, thank you so much for coming in. It's been a pleasure.
I've learned a lot.
Thank you.
So changing direction slightly, we've got a very exciting guest here today. Grant, perhaps you'd like to introduce Amy for us.
I'd love to. Amy Castano started her career in accounting and has now become one of the most successful beauty influencers in Australia. She has built a hugely successful personal brand and has gained a following of more than 500,000 people.
So Amy's worked with some really, really cool brands. So she's worked with Fenty, Estee Lauder, Benefit, MAC Cosmetics and L'Oreal Pro, among many others. Her work has provided her with global experience and global reach. Welcome, Amy.
Thank you for having me.
It's our pleasure. Now, I've spent more hours than I would like watching makeup tutorials over the last day or two, preparing for us meeting you. And one of the things I saw a lot of in the tutorials was making your nose look thinner.
Yeah.
So explain how we kind of do that.
Yeah, so with makeup, you're obviously trying to make the face look asymmetrical as much as possible.
Yes.
So with that, you're going to contour, highlight, add different things, add different colours in different areas to make it look thinner, if you're talking about the nose.
Yes.
So with making the nose look thinner, you are going to add highlight in the middle.
Yes.
And then add contour on the outsides.
Right.
So creating shadows and bringing forward the middle of the nose.
Yeah, cool. And how do you do that?
So pretty much you would obviously do your makeup normal, as you would know from watching all those tutorials last night.
That's right.
So you would start with foundation, and then I would go for a cream contour. It's easier to use, so that's a cream-based product.
As opposed to
powder. So starting off with cream
Yes.
is much easier to manoeuvre around the face.
And is that like different coloured creams? Or?
Yes, so you would use a lighter colour in the middle of the nose, and then like a darker colour on the outsides of the nose.
And how do you actually put that on? Because I did see that there was like, some people they got the finger method, some people have little brushes.
I like to use brushes.
Okay.
I like to use like a smaller, like a nose contour brush.
Ah, yes.
And that's like an angled...
So there's a specific brush just for the nose?
Well, I call it a nose contour brush, but it could be like an eyeshadow brush or just something like really like tiny so you can create fine lines.
Yeah, okay.
Yeah.
And then if you're doing the bronzer around the side there?
Yes.
Is that
Yes. So bronzer, yes, you nailed it.
So do you draw that around the side of the nose? Okay.
So you would do it down the sides of the nose, and then in the middle you would do the highlight.
Do a bit of highlight.
Yeah.
And I can imagine there would be some kind of pitfalls with that where like girls may go, or guys may go a little bit too close together or far, but is there any general rules or it's more of a sculpting process?
You just need to, when you obviously do your own makeup, you need to know your face. You need to understand your face. It's all about trial and error.
Yeah.
And it's an art form really. So I think it's good to trial different methods and trial different ways of doing your makeup, because that's how you get to know your own face.
Yeah.
And play around. Like, it's fun. Makeup's fun. There's no rules. I feel like there's no rules.
Oh, good.
Yeah.
And how would you kind of suggest people go about learning? How would you do it if you had to start again?
Tutorials.
Yes.
There's a lot, as you know.
Yeah.
Tutorials, I think online, like get online,
like
Google
YouTube or
things.
something.
Yeah, YouTube, Instagram,
Nice.
TikTok.
Yeah.
There's so many ways.
Cool. So once you've got that actual makeup, like the, I guess the train tracks down.
Yep.
What do you do then? Like.
So you would set it in place.
Okay.
So everything that you do, you'd want to set it with powder.
Okay.
Otherwise, it's just going to slip and slide all over your face.
Yeah.
So that would be called baking.
Oh, yes.
and
Don't get too excited, Grant. It's not the baking
cookies.
of Geelong back 20 years ago.
I was talking about cookies.
Yeah.
Cookies and cake.
Sticking to the kitchen nose metaphors.
Yeah,
I'm following you.
Yeah, okay,
yeah.
cool. So you would bake the face, and that's just putting powder on there for a certain amount of time and then brushing it off. So it sets everything
with
in
a
place.
brush.
Yeah, with a brush,
okay.
yeah.
Cool.
Yeah.
Awesome.
Amy, I wanted to ask you, we've talked about making a nose look thinner. What about when people think, okay, my nose is a bit long, I want it to make it look a bit shorter? What can be done?
So with contouring, the beauty of it is that you can create shadows in areas that probably wouldn't have shadows. So if your nose is a little bit longer, you can add like contour on the tip of your nose, like bronzer on the tip of your nose, and then that would create like a shorter looking nose. So what you're doing is essentially adding shadows where there isn't, which controls the way that people see things on your face.
And I guess that would also apply to the top of the nose. If it's seemingly quite high, that same technique can be applied?
Yeah, absolutely. So one of the most popular and very on-trend things at the moment is adding bronzer just there to make it look like you've got like a cute little button nose. So it like
cool.
kind of like dips your nose in.
Yeah, nice. Yeah. Do you find that when you make the nose look thinner, sometimes you can make it actually look longer as well? Is that a thing? Or
Yeah,
am I
you
making
can
that
actually.
up?
Yeah, you can.
So combining the two things might be a good idea.
Yeah, absolutely. Yeah.
Amy, you mentioned before that, of course, this is a form of artistry. And when we think about noses that have the natural variations, but also those that are different because of surgery, sports-related trauma, one of the common ones is either a kink in the nose or something prominent. How do you go about addressing that as best you can?
Yeah, so I guess with adding makeup to the face, you do want it to look the same on both sides, and that's what we're trying to do and achieve with makeup. So when you are contouring a nose or any part of the face that is different to each other, you would probably add more product on a certain side or a certain area. Especially with contouring, it probably won't be the same on each side, just depending on whatever your face is, and that's all about trialing and error, what works best for your face.
That makes sense. And also, I imagine if you're looking at using different shades to create the illusion of depth or the perception of it, how does that relate to what you might do for the rest of the face? Is it a factor?
I definitely think so. When you are creating shadows, you try to use something a little bit more cool toned. So a bronzer that is like probably like a little bit more grey based. And then if you want to create like a sun-kissed look, you would use something that's a little bit more warm toned. And then you obviously want to tie that all into the face. So if you do use a grey tone on your nose, try to use that in the cheekbone area, around the temples, and then also tie that into the face by using warmer tones in those areas as well.
That makes sense.
Yeah.
And one more thing I wanted to ask, what are the most difficult cases for you to do? Is it about nose shape, nose size, expectations, skin tone?
I would say expectations are the biggest thing. I think you guys would be very much aware of getting brought in a photo of how I want to look,
Yes.
and then trying to, I guess, try to get that expectation for that person or that client, and then, I guess, not being able to achieve it because of, I guess, their face isn't the same as the person that they brought in. So I think expectations are the biggest hurdle.
And what would you advise someone generally? They're thinking, I want to achieve something with makeup for my nose. Where would you generally advise them to pitch their expectations?
I think your own work. So obviously if they book you as a makeup artist, it would be more so because they've seen your work and they loved your work. So I would definitely say looking at a makeup artist's work prior to booking them is probably where you pitch your expectations rather than a celebrity that you
randomly found.
Yeah, exactly.
Yeah, makes a lot of sense. So,
you talked a little bit about like different products, different brushes and stuff. Does that stuff matter?
I would say in terms of brands and things like that, you would have your favourite brands and loyal to a brand.
Yeah.
But I think it doesn't matter. Like you could go from, super cheap to super expensive and it doesn't really matter. It's how you use the product.
Some more the skill.
Yeah, I think so.
So you can go down Woolies and
absolutely
get after it.
Priceline.
like Josh does.
Yeah.
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 Explains a lot.
Pleasure.
Yeah.
So we talked all like the good ways of doing things. You see some disasters out there.
Yes.
What are the common things people do wrong, you'd say?
I would say probably using too much product.
Yes.
Less is more, especially with makeup.
Yeah.
I think if you think you've got enough on, you've definitely got enough on.
Okay.
Don't go overboard. I think as well blending.
Okay.
Like if you're just drawing lines on your face and then not blending it out properly,
Yes.
you want it to look super seamless and
Right.
natural.
And have you got tips for blending itself?
Yes. So I would say that, obviously blending with a brush is one thing. I use a beauty blender, which is a sponge, and that sort of melts all the products together. I think blending, making it look seamless and as natural as possible.
Cool.
Yeah.
Nice one. Look, I think that's about all the questions we have. Do you have any kind of general tips, tricks, things that we haven't spoken about that you'd like to pass on?
I think just keep it natural. Everyone, you see all these like amazing makeup tutorials out there and it's really cool to see.
Yeah.
Keep it natural and play around. Like also try what fits you best and go with it. Like there's no rules. Definitely try different makeup, different techniques and don't be afraid.
Beautiful. Well, thank you so much for coming in.
Thank you. I've learned a lot.
Welcome.
Yeah,
Well,
Josh
you
will be
can
hitting up the
probably-
makeup soon.
Yeah, you'll probably be able to teach me stuff
I'm
now.
gonna look beautiful tonight.
Yeah.
He's got the best nose in Sydney.
Yeah, best agent.
Shiny and straight.
So I think that wraps us up today.
Yeah,
Dr.
we've
Grant.
covered noses uphill and down dale.
So tune in thank you very much for everyone that's listened, and tune in next week. We're going to go over everything jawline,
Everything.
filler, chin filler, sculpting that perfect snatched jawline, very much like your own, Dr. Grant.
Yours truly. We'll whip out some needles and do a bit more, get this to your lofty, high standards out there. Not all of us can grow a disgusting, filthy beard to hide the mistake that God made under there, but we'll talk about a more fortunate jawline next time.
Absolutely. So thanks to everyone that's listened, and we will see ya.
See you later.